welcome to the NEMSIS V3 implementation call. Today is January the 14th, 2026. Like I said earlier, if you haven't already, please update your name with your affiliation in the participation list. These meetings are recorded and shared on the NEMSIS website and YouTube channel, so feel free to share with your team and review as needed. We encourage your participation, so please use the QA feature to ask any questions or make comments. We review these during the meeting as well as during our post-meeting debrief. Please know Zoom does not have an option for using the QA or chat feature when calling in via the phone. You can email us or submit a help desk ticket with any questions if needed. So as usual, I have the first agenda item, which is the stakeholder introduction. We'll get to that right now. So why do we do stakeholders introduction? It's to get to know others on the call, to build connections that can lead to collaboration, get some ideas for new hobbies, spotlight somebody for 30 to 45 seconds, and maybe just have a little bit of fun. We always ask the same, what do you like to do to relax or unwind? This person likes to spend time with family and activities with the kids and a quiet time with a good cup of coffee. I can certainly relate to the good cup of coffee and the family time as well. Some interesting facts. Cashier at a grocery store and then started the fire department when he was 19. And this is what our AI thought you would have looked like when you were 19 as a cashier and then as a firefighter. Something others may not know. He brews his own beer at home. This looks like a pretty big setup. I think it looks like you brew a lot of beer at home. Well, maybe we can try some of that at the next annual meeting. How long have you been in EMS healthcare or data? 19 years. What do you like best about your job? Transitioning from an agency or field level to a vendor has given me the ability to work with departments nationwide. I'm enjoying the opportunity to have a larger impact in the fire and EMS beyond the local level. Helping departments maximize the benefits of their systems brings me great satisfaction. So, any guesses? And before I share the last slide, I will say that number one, I only show pictures that are sent to me, typically. And number two, I now know why, Austin, you've always had a beard since I've known you. And I believe that is probably a good decision. Just joking, man. So if you've not been introduced, please scan this QR code and fill out the questionnaire, and I will introduce you and probably make fun of your mustache at the next meeting if you have one. I'll also put a link in the chat if you're not using a cell phone. I've also noticed I've gotten some pictures from people with no forms. So just know that at the end, when you click submit picture and you submit your picture, you've got to go back to the form and then hit submit form, or else I don't get it. I'll just get your picture, then I don't know anything about you. So please do that. I've got the second thing on the agenda as well. Just a reminder about the research data set cutoff date is going to be February 13th, 2026 this year. Please don't break our hearts. Submit your data. As it'll be talked about in depth in a few minutes, there's been a CP6 reset. So now is a great time to go back in and resubmit all of those XML failures you've had since November the 4th. That's the date to look at for XML failures going forward from November 4th. And as those of you have gone through our data missingness project has known, run a quick warehouse report and just look for any odd agencies that have gone from submitting a lot to none. Maybe possibly reach out to those agencies and see if they can resubmit those months. If you have any questions or need any help or would like to schedule a data missingness meeting with us, please email me or create a help desk ticket. And so that is all of mine. Next up is the new NEMSIS monthly research highlight, and Mr. Chris Hoffman, you're welcome to present.
Perfect. Thank you, John.
Mhm.
Let's see here. Let me replace current share and we will show this up. So today I'm very excited to share this new deliverable that I'm producing here for NEMSIS. So we were asked, and we've had this as a request before, where we want people have asked for documents or simple one-pagers that talk about how NEMSIS data is being used. And so now the initiative this year is to have here what's called the NEMSIS Monthly Research Highlight, where we take a piece of research that has used NEMSIS data and create a one-page shareable deliverable that everyone can share out with their colleagues. They can print out and put into their break room. Everything in this it's designed for shareability. So you should have seen one in your email for December. This is the January highlight. And to just kind of go over the features of the flyer here, we have the headline, a summary of what the article is talking about, a QR code and a link. The links are all clickable and shareable in here. So if you want to post this up on social media or anything like that, that is all possible with this. So, but we're going to be picking one very cool. They're all cool when it uses NEMSIS data, right? But we'll be picking to have one in the spotlight so that you can have this as a item to share when anyone asks about this. So hopefully this is something that everyone will find useful. If you have any questions about this, or if you have any ideas or that we can add or contribute to this, would love to have live on feedback and improvement here. So yeah, get in touch through the help desk ticket and let us know what else we can do to improve this and what other kinds of products and deliverables that we can make that help out with your everyday work. But that's it for
Great,
me. I'll give it back to John.
great. Thank you, Chris. I won't take over sharing. The next person up is Monet with our monthly report.
Thank you so much. Happy New Year, everyone. Sure look forward to seeing you this year or speaking with you over the phone. Today, I'm going to show you how to get to the report, and I'm also going to add the link in the chat so that you have it easily accessible. You go to View Reports, and then it's Public Reports, and it's the monthly report, and this is the report for December. And if you have an opportunity, if you were out, took some vacation time off, hopefully everyone took some time off to restore, rejuvenate. And you're coming back and you want to know what you missed, this is a great way to just figure out what's going on with NEMSIS. We have the previous call listed here. We also have the information about the previous training. And then we also have some information that was sent out via our MailChimp about the reset for the critical patch. So you can take a look at this information as well. We have updates on this compliance of software vendor compliance status, as well as a screenshot of what's available on the website. And then we have information about some of the activities, the collaborations with NASEMSO, for instance. We have the State Data Manager annual report template. That information is still here if you want to utilize that template. And then, of course, there are some other research publications here listed. And so this is the report. It's available for you at any time, or if you need to review previous reports. They're on that page. If you have questions, certainly feel free to send us a message and we'll consider um, your suggestions and see if we can add them to this report. And since I'm on this last page, of course, I'm going to ask if there are any outstanding data use agreements. We're going on 4 years now to try and complete these. So if you're still working on a data use agreement, I would love to continue to work with you and your compliance team to get these documents executed. And thank you so much. Have a great rest of your day. Back to you, John.
All right, thank you, Monet. Next we have Randall with the NASEMSO update.
Thank you, John. I believe I have the next 3 topics, and I'm going to just share my screen and go through all 3 if you don't mind.
No problem.
All right. John, you seen the NASEMSO
Yep, that's
slides?
great. Yep.
All right. So first from the NASEMSO update, first thing here is just the 2026 NASEMSO annual meeting, April 26th through the 30th. It seems like it's a far ways away, but I think it's going to be here sooner than we think. QR code here will lead you to the page. You're able to sign up. There's a schedule at a glance. I know there's an agenda that's coming very soon. Also, once again, if any of the sponsors are on the call today and you're still looking for a slot to either speak or present to a council or committee, please make sure you reach out and get that completed for yourself. Next here, we have some guidance documents. So we have 4 total guidance documents we're going to talk about. The first one is the pre-hospital transfusion of whole blood and blood products, considerations for state officials. So this is a consolidated document between different councils and committees of NASEMSO. They've all put input in. A lot of great work went into this. It's definitely worth the read. This document is public. Here is kind of a diagram of where you can access this. So following the QR code, you can go to the NASEMSO website. Under the documents, you'll see a folder for the pre-hospital blood, and there you should be able to download them both. Like I mentioned, download that one specifically, and it should be a public document. If you're having troubles getting that document and you'd like it, please feel free to email me and I can assist you. The second one on here was completed more by the data managers. There was a lot of input from outside sources, of course, but data managers council worked very hard on this. And this is the NASEMSO Blood Product Administration Document version 2. So if we remember back in January of 2025, we had document version 1. So this is a much more in-depth document. And once again, I would recommend going in and downloading that. It's a public document, so if you're having any troubles with it, please let me know and we will get that to you. Next one here is about the artificial intelligence use in EMS. Same QR code, same location, just does not have a subfolder here for this one. As you can see, there's other documents in there. If you're interested to grab those while you're there, feel free to do so. But you'll see the artificial intelligence use in EMS document in there for download, and you'll also see the requesting EMS data across states, key considerations and guidance. So both of them have been placed in there, and definitely recommend you downloading them. Any questions about the NASEMSO update? All right. We're going to kind of jump into the violence against EMS personnel. Give a quick overview once again, and then we're going to kind of discuss the some of the more final details as we've get closer and closer each day. So once again, the violence against EMS personnel, that project did start off as EMS clinicians, has been sort of opened up into all personnel that could be working for the agency. So, objective 1 here was to explore additional field values for E other 06 to capture violence against the EMS personnel. That has been completed. We'll show that on the next slide. And then the second task here was to develop a draft data dictionary. We kind of created a work group. A lot of facilitation went on, a lot of back and forth, surveys, feedback, recommendations. We got these questions out to a lot of folks. We've really picked through them. We've compared data elements that are existing within NEMSIS already, and we feel like we've come out with a very good data dictionary for this. So first here we have the NEMSIS version 3.5.1. You have your E-Other 06. New field values have been added. And then just a couple of highlights once again for the violence. The EMS personnel will be empowered to confidentially and securely provide information about violent encounters to their supervisors. Establish a reporting that encourages response, support, and action from an EMS supervisor so that, we're not just reporting, but we're actually seeing some type of feedback coming. And then aggregate and de-identified information may be used to understand the impact of the violent encounters on recruitment, retention, and the needs for safety, education, training, and resources. And then once again, what will the data tell us? Characterize the frequency, the type, the impact of the violence on the EMS workforce at the agency, state, and national levels, and if and what type of action is needed from policymakers and elected officials, and then the type of training, resources, education, EMS clinicians or EMS personnel would need for preparation, mitigation, and action when facing the violent incident. So discusses a lot internally about this violence form. Let me just 1 second here. Thank you. So the violence against EMS personnel needs to exist separately from the EPCR record so that the violence information wouldn't be included in the patient care record that is shared with receiving facilities, billings, or is discoverable. The existing NEMSIS data elements that were completed during an incident could be populated into the violence against EMS personnel using the NEMSIS data element standard already. So just kind of just 2 examples here, just so, just to sort of make it sort of easy for me or for everyone to understand. So you have 2 crew members. This is for a crew member situation where they're on an incident, and the crew members or EMS personnel would need to complete a violent report if needed, where there was a violent incident that took place. And they would each have to fill out a separate report, even though it's on the same incident. Each one of those clinicians, they could have a different kind of experience. It could have happened on a different phase of the call. They could have experienced different injuries, and they also going to have a different follow-up or outcome associated with this. There's also an example on here of, let's say we go to an incident or a scene where there's 3 patients. If there's 3 patients and all of them are violent, then you would have to have an individual violent report for each one of those patients, or if it's one of the 2 or one of the 3 or 2 of the 3, there would be additional violence reports that would have to come out per patient, all once again, depending upon the event. So the violence against the EMS personnel, it's going to be its own data set. It's going to be beginning with the letter H, like we have now, like E-response, or we have our demographics with the D. This one has just been chosen to be H. This data will include the details for the violence against EMS personnel data elements. It has the numbers, the sections, the existing NEMSIS data elements that are copied from, the violence element name, there's a violence element definition with it, the data type or field values, there's existing NEMSIS data types, and also the recurrence for each data element. And so that's all kind of put out on a spreadsheet. And this view I have on the screen now is kind of showing that we've taken the data element that is standard in NEMSIS now, like E-response 03, which is the incident number, and we'd like that to populate over into a violence form so that we're aware of what incident it is. And so on the data set for the violence form, it's actually H-response.01 because it's the first number, and it would continue for any other items that we've put into the response section in numerical order. Another example there is like E-scene 09, the incident location type. For the violence form, it would be H-scene 01, and E-patient 15 would be H-patient 13. So there is a full list on this Excel spreadsheet. I'm kind of doing some fine details on it, making it very user-friendly to read, and that should be posted onto the NEMSIS website for everyone to grab. A lot of effort went into using the existing sections of the of NEMSIS. You can see that we've used the D personnel and the E crew. The reason for the 2 categories is besides using some of like the EMS clinician's age, sex, length of service, you could also write this report if they weren't actually on an incident. meaning that there was no crew at the time because it was just a personnel. Maybe they had a violent experience with maybe like within the hospital or within the station themselves. You could just use the personnel fields. If they're actually on a response, then they're part of a crew, and you could grab those details from the crew member details. There's also the sections of response, e-dispatch, e-scene, e-times, e-patient, e-situation, and e-history. As I sort of flip over here to the violence sections, you can see that we kind of repeated all of the same violence sections, except for with the addition of the H in front versus the E or the D. And there's two additional sections that on some of the data elements that have been created actually just don't fit, which would one of them is under H violence and the other one is under H supervisor. Here's kind of a pretty long list, but this is the list of the data elements that will be created. Once again, on the spreadsheet, you'll have the number associated, or the data element section and number it's associated with. You would have the data element itself, the definition, the recurrence, any field values or data types with these. And then just one last slide on here, there is another section for the supervisor, which is just the three data elements, the 30, 60, and 90-day post-incident. So once again, quick overview for everyone. I'm willing to take any questions you have, but the spreadsheet with the entire data set will be posted, and I will make an announcement about that when it's done. Any questions or comments? All right, and I'm just going to move on to the national custom elements then real quick. First, last time we talked about the updated definition for e-medications 905, which is the blood product unit number. That definition has been updated. It is current on the NEMSIS website right now. The other one that was in process last time we spoke was the date time medication stopped. That one is also currently present on the NEMSIS website under the national custom elements. And then we're still waiting on two more. I think I might have submitted them just a little bit late for everybody, but it's the blood facility ID number, or the FIN. And then lastly, have also submitted to the NEMSIS help desk the medication status at patient transfer of care. So this one has also been submitted, and we will just be kind of working back and forth and make an announcement when those are posted. Any questions about national custom elements? That's all I have for today, John. If there's any questions, I see there's something in the chat. Oh, activity report. So.
Thank you, Randall. So we're actually going to go back to Ben to do the maintenance update. He has joined the call now.
Yep, it's very lengthy. The maintenance window will be next week, Tuesday and Wednesday, which is January 20th and 21st. So just as a reminder, when services are patched and upgraded, you don't need to open a help desk ticket for issues during that time period. But please let us know after that window if you experience any issues, and we're happy to take a look. Other than that, that's it. Thanks, John.
Great. Thanks, Ben. All right, Casey, now you're up for the versioning timeline.
Are you able to hear me, John?
I am now, yes.
Perfect. All right. I'm going to just share my screen real quick. So we've had a lot of questions about versioning, what the plan is. So this is an overview of kind of what we're thinking, the cadence that we want to follow. So the plan is to start moving forward with a minor revision, version 3.5.2. We have several requests in the queue. We have a few more we're going to go over and try and get approved by our committee and get out to stakeholders for further review. And then we won't be looking at a major revision, sorry, until late 2027, start production 2028. That's the current plan. And just to kind of give you a quick overview of what some of this stuff means. So the development kind of can mean a different thing when you're in like the vendor side versus our side of things. So that's just we're going through the proposed data set, doing revisions, working on getting it finalized to be able to move to the production time frame, which would be things are available to states and vendors for implementation in products and processes. And just a reminder that the minor revisions, they're backwards compatible. So if the state has the current minor revision and agencies do not, they can still successfully submit records. However, if a major revision, that does not work that way. And just to kind of go over real quick what the differences between major and minor are. So again, minor backwards compatible would be things like new values to existing elements, deprecating a value. So deprecating is indicating we're going to remove that value or element in a future major revision. The actual removal of that would be part of a major revision. Deprecating is not. Adding new optional attributes to existing elements, adding a recommended or optional element, changing a schematron rule from error to warning. And so just anything that does not change the XML structure. So it's permissive, things work smoothly, and we don't have to make a ton of changes kind of thing. Major revisions are not backwards compatible. These would change the XML structure. So things like adding a new mandatory element or a new required element, upgrading rules from a warning to an error, removing elements or values, kind of different things like that. Changing the usage or recurrence of an element also can have those effects, making it major versus minor. So again, this is just kind of what we're looking at. This is the plan for now. Obviously, things happen. Things can always change a little bit. I also wanted to just kind of point out that, critical patch is not included in this because it's kind of its own thing. Those are the hurry up and get done kind of situations where we found a critical issue. We have to change it right now or things aren't going to work kind of situation. So that is all I have on that. If anyone has any questions, comments. All right, John, back to you then, I think, sir.
Great. Thank you. Next up on the agenda is the 3.5.0 CP5 reset, and Mr. Jeremy Kinsman and Josh Legler will be presenting that.
Hey, good morning, everyone. Can you guys hear me okay?
Yes, can you great.
Okay, thanks, John. Sorry, excuse me. Yeah. Happy New Year, everyone. I've got, I think, the next four items on the agenda, so I'll just run through these first. As John mentioned, the critical patch kind of reset here. Just a little background, and then I know Josh is on the call to answer kind of any technical questions that folks might have, but just wanted to give you guys a little bit more detail from our end, kind of why we asked the NEMSIS TAC to do this. So I think as folks are aware, the most recent critical patches were, we needed to put those forward to comply with the presidential executive order on patient gender and patient sex. And so we made the transition over to the most recent critical patch versions, which made those new data elements. I think ePatient 25 is the one that folks are probably most familiar with, which was on patient sex back in November. So after the TAC made that switch, they informed us at NHTSA that there was really a large increase in record failures. So obviously, for us at NHTSA and for the team at the NEMSIS TAC and others, we're really kind of concerned about protecting, our ability to collect near real-time, near complete census data. We also want to ensure that we've got a complete data set for the 2025 research data set. So we talked with the TAC about several options and what we could do, and ultimately settled on, well, okay, we really need to kind of temporarily reset the national repository back to the previous versions of the critical patches. And so that occurred back on January 9th. Again, we temporarily reset them back to version 3.5.0 CP5 and version 3.5.1 CP1. So again, the primary purpose there was really just to ensure that we can collect all of the 2025 calendar year data before we close the data set, which generally, I think folks can correct me if I'm wrong, which is around Valentine's Day. And then obviously, with everything, all of our current administration's interest in pre-hospital blood and some of the kind of surveillance tools that we're starting to put together, dashboards, and also, the White House interest in maintaining the opioid overdose dashboard and the need for us to kind of continue to collect that near real-time, near census data, we felt like it would make most sense to kind of reset a little bit time to just kind of give the states that are experiencing those CP6 related submission failures time to resubmit records and kind of stabilize their processes. And so that's essentially why we decided to make this decision. I know our what we expect right now is that we'll restore the CP6 and CP2 back to those versions on April 1 of 2026. So I'll stop there, see if you guys have any specific questions for that part that I just kind of laid out. And I can also answer those just after Josh's presentation on any more technical pieces. I'll just kind of hand it over to you, Josh, now, if you want to add anything on the technical side.
I know I don't really have anything else to add. I think you covered it perfectly. Just allowing records that weren't built in CP6 to continue to flow in for a few more months and give people a little more time to get over to CP6.
Okay, thanks, Josh. I don't think I see anything in the chat, but as questions come up, I guess Josh and I will be happy to address them. But I'll just I'll keep going now unless someone wants to stop me. All right, just an update from our office, from the NHTSA Office of EMS. Several things to update folks on. NEMSAC first, our National EMS Advisory Council. The representative selection is still in progress, but we're really hopeful that we'll have a big announcement soon on our new all our 26 members that will be representing NEMSAC over the next 2 years. For our Federal Interagency Committee on EMS, or FICOMS, I think folks were probably aware we had a pause on FICOMS related work really due to the lapse in federal funding that occurred towards the end of last year. But we don't have any announcements right now on when our FICOMS public meetings will be, but we anticipate that we'll have several this year in calendar year 26. And so as soon as we have announcements about those meetings, we'll let you all know. Just kind of a list of items that we're going to continue to kind of focus on over the next year in our office. We're going to have a big focus on advanced automatic crash notification, kind of integration between 911 and EMS data. One thing I want to mention is our colleagues, Brian Tegmeyer and Joni Harvey, who lead our National 911 program as part of our office. They do have a contract with Mission Critical Partners. And one of the things Mission Critical Partners is going to help us understand is where we have across the country good integration between EMS and CAD systems. And they're specifically going to be looking at some of our NEMSIS e-dispatch data elements. And so through us, they may be reaching out to a few states and locals to try and understand, like, hey, where is CAD, and kind of, how are those e-dispatch data elements documented, and where do we have really good integration between CAD and our EPCR systems, and like what's working really well and why, and what can we do to kind of replicate that across the rest of the country. Josh and Clay in our office have been working with the folks at NARIS for some time now. We'll kind of continue to work with NARIS on trying to harmonize as best we can our NARIS and NEMSIS systems. And then, our office is really going to continue to kind of focus on post-crash care, specifically on extrication, on first responder safety at the scene of the crash. And obviously, we're going to have really continue to have a lot of big initiatives around pre-hospital blood, and obviously continue to do our work to support kind of evidence reviews and development of evidence-based guidelines. I do want to make just one kind of final announcement here on an update specific to our office, but we do have an upcoming EMS Focus webinar. It's going to be on February 10th at 1 p.m. Eastern. So we're going to host a session on kind of strengthening collaboration between EMS and highway safety partners. And we're going to have a presentation focused on Maine's statewide collaboration model. So Lauren Stewart from the Maine Bureau of Highway Safety and Will O'Neill from the Maine Office of EMS are going to kind of give a presentation and discuss how they do their kind of cross-agency data sharing and how they've integrated TIM practices and kind of coordinated operations on highway safety and EMS responses. So I think that'll be a great presentation. If you guys can join, that would be great. I'm gonna pause and blow my nose here for just a second. I apologize. Okay, gonna keep going here. Federal grant announcements and updates. Folks may have seen some recent announcements from us on FY25 SS4A grant recipients. So in total, SS4A has provided over I think 1 billion in grant funding now to local communities, and this includes 24 grants totaling 50 million specifically for pre-hospital blood intervention. So SS4A has been a way for our partners at the local level to access federal dollars for post-crash care initiatives and specifically for pre-hospital blood. So we have had partners awarded in California, Missouri, Oregon, Texas, Washington, and West Virginia, and the Katawawa Indian Nation as well. So it is a grant opportunity that's out there that I think our sense and understanding is it's going to continue to be out there, and there'll probably be an announcement, a notice of funding opportunity announcement sometime in the next couple of months about a funding opportunity for FY 2026. So we would just encourage you to check the SS4A website regularly. You can also sign up for our Office of EMS listserv. If you have not already, you can go to ems.gov and scroll down, and it should be on the right side of the page there. So we try to do a good job of making announcements about SS4A via our listserv. But you can also check their website, obviously. But we continue to think that's going to be an opportunity for our local partners to get some federal dollars to help support post-crash care and pre-hospital blood. Just transitioning now into a pre-hospital blood update. I know I've mentioned it on several previous V3 calls, but did just want to announce again, since we did have a formal announcement that came out that we do have this partnership with the Uniformed Services University's National Institute for Defense Health Cooperation, or NEDIC, where we're going to be working with them to expand access to pre-hospital blood transfusion. And so this includes the development of 25 new pre-hospital blood transfusion programs over the next 3 years. A big part of that is going to be an impact evaluation that we're going to be doing, where we really want to specifically understand what impact does pre-hospital blood have on motor vehicle crash patient outcomes. So NEDIC has partnered with the Johns Hopkins University Applied Physics Laboratory to kind of serve as the data and analytic core for that project. And as we kind of bring on our implementation partners and identify the EMS agencies or the implementation sites, the demonstration sites that are going to be, providing pre-hospital blood under this effort, we and the team at the NEMSIS TAC, Josh Legler, are going to be working with those local EMS agencies to ensure that they kind of have the right, and obviously this group at Johns Hopkins, APL, we're all going to be kind of working together to make sure that those EMS agencies have kind of the right data collection systems in place, that they can access and have good partnerships with the hospitals in their area where they transport the patients to, of outcomes for those patients. And so I think certainly our state partners, our vendors, our EPCR vendors, and those health systems, we can anticipate that we'll kind of all be working together to support that effort. So as we've got more details about that, I'll make sure folks are updated. I think it's going to be a really great opportunity for us to show kind of the value of EMS and pre-hospital care, post-crash care, and how pre-hospital blood can really save lives. So really exciting stuff there. And then just finally, our team at the NEMSIS TAC has been doing some great work related to pre-hospital blood. They have a near complete kind of pre-hospital blood data definition for patients who could benefit from pre-hospital blood that is really initially kind of focused on motor vehicle crash and trauma patients initially. And so I know we'll probably have some updates and announcements, and we'll be sharing some materials related to that soon. They're initially working on some internal dashboards for us that we're hoping to transition into some public-facing dashboards over the next year. And then we're also working on a more of like a PDF report, a regular PDF report that will be kind of national in scope, kind of summarizing and characterizing, EMS out of hospital blood transfusion. So we're really excited about that as well. And I will stop there and just see, does anyone have any questions on any of those announcements? If not, it doesn't look like it, but I will be on the call for the rest of today. So I'll be on for the rest of the call today. And if folks have questions or if there's anything I can help with, let me know. Thanks. Back to you, John.
Sorry about that. I had a slight issue with my Zoom. Thank you, Jeremy. I've shared the agenda. So as you can see, the next meeting will be January the 28th, will be our next V3 implementation call at standard time and place. February the 3rd, we'll have a public training. Again, we'll send out the information about that prior to the meeting. I'll be teaching that one though. And then February 11th, my birthday, we'll have a V3 implementation call at the standard time and place. So now is the normal open forum time. So if you have anything, please put it in the QA and we will answer it online as quickly as we can. Give people a couple seconds to think about that. Literally a couple seconds. All right, Amanda, you want to give us a reminder of breakout room conduct?
Yes, I do. Good morning. Before we move into breakouts, just a few quick reminders. Vendors, you need to join your assigned breakout room in order to receive credit for attending today's call, so make sure you do that. And please be sure to join only your designated room and do not enter other people's rooms without permission. And as always, while in your breakout room, we ask that everybody just keep conversations professional and respectful. And thank you so much again for joining today. You can go ahead and join into your breakout rooms.
Thank you, Amanda. You should see a prompt on your screen to join a breakout room you've been assigned to. Just click join. If you have any issues, we'll have some tech staff here in the main room, so please let us know and we'll assist you.